Hi, I'm Representative Ivy Spohnholz, and I'm here today to talk to you about healthcare price transparency via my bill HB123. In the United States, we pay more for our healthcare than any other country in the nation without better health outcomes to justify it. And in the state of Alaska, most of us spend thousands of dollars more every year on healthcare than do our friends in the lower 48 states. It's time to address the elephant in the room with regard to the cost of healthcare. No one really understands it. As healthcare consumers, we don't know the prices of our healthcare services that we buy before we receive them. This lack of information prevents one of the most fundamental tenets of capitalism to function, and that's the power of the consumer to make informed choices about what they do or they don't purchase. The intent of HB123 is to create a foundation for the long process of decreasing healthcare costs in the state of Alaska. It's one of many strategies that our state is going to need to undertake over the next few years in order to truly make a difference in the cost of healthcare. Healthcare price transparency empowers consumers to take more financial responsibility for their healthcare by giving them the information that they need about the cost of the healthcare services that they consume. Healthcare providers will be required to list the 25 most frequently offered services on the lobby, in their reception areas, on their websites, and to send that information to the state of Alaska as well. Healthcare facilities which offer a wider range of services will be required to list the top 50 most frequently offered services in the same places. This bill passed the House last year 34-6 and is on its way to the Senate now. Since last year, I've spent a lot of time working with healthcare consumers and advocates, providers, and insurers, and have incorporated a lot of their feedback in order to make it a more robust and effective bill. A new version of HB123 will also require providers to make a good faith estimate upon the request of the consumer. This is modeled on the municipality of Anchorage's healthcare price transparency ordinance. This is important because we want to make sure that every Alaskan has the opportunity to benefit from this information. And the ordinance that we've included will require that healthcare providers provide this estimate either in person, written, or via email within 10 days, or by the date that the service is provided, whichever is shorter. Providers and hospitals will also be required to let healthcare consumers know whether they are in or out of network with their individual healthcare insurer, so that consumers can make informed service decisions about where they choose to get their healthcare provided. This is important because there are often very large differences in healthcare coverage by insurers if your healthcare provider is not in network. HB123 is a constructive step in the right direction, getting real information about healthcare costs into the hands of healthcare consumers so that they can make informed decisions. HB123 is not a silver bullet, and it's only the first step. I often describe our efforts to reduce healthcare costs in the state of Alaska as a marathon, and this is the first mile. There'll be another 25 to go after this, but it's a very important first step because it puts consumers back where they belong, in the driver's seat, giving them the information that they need to make informed decisions about their healthcare purchases. If you'd like more information about the bill, or if you'd like to testify, please go ahead and give my office a call at 907-465-4940. Thanks for your time today.